Welcome back to Sarah Has Questions. Today's topic is lung cancer. You may have been a smoker in the past and think you're out of the woods because you quit. Well, it might not be that simple. And turns out there is something in our homes that could be contributing to your risk. We have a lot to cover in this episode, so let's get into it. I'm Sarah King, and I have a lot of questions. What exactly happens when you orgasm physically? Will popping a knuckle or a joint give us arthritis? What can we learn from our poop? The size of your body doesn't necessarily indicate your measure of health. Yes. And what are your thoughts on that? Cleansing. Do we need to do anything special to our nether regions? In this show, I get to ask all these questions to WakeMed doctors who happen to know everything about everything. Sarah Has Questions is a production of Capital Broadcasting Company and Mix 101.5. It's presented by WakeMed. Today, I am talking with Dr. Vicki Fowler. You are a family medical physician with WakeMed, and we were just talking off air how important family medicine is. As a family medicine physician, I'm sure you see lung cancer from time to time. Apparently, it is the leading cause of cancer deaths worldwide. Why do you think that is?
There's a lot of factors contributing to the leading cause of death being from lung cancer. And as you mentioned, lung cancer is a leading cause of death leading cancer cause of death in the United States, in North Carolina, and actually in the world. Variety of factors. And one of the things I want to really talk about today with you is the importance of knowing your own risk and how to find out through your physician if you qualify for screening, as well as ways to lower your risk.
Okay, well, let's start with how you figure out someone has lung cancer. What are the symptoms? What could we be looking out for?
Well, the symptoms of lung cancer, and this is one of the issues, can be very common, and they can be associated with other conditions, such as asthma, emphysema. The issues that you want to go to your primary care physician and mention if you develop them is a persistent cough that does not resolve. Certainly, if you're coughing up blood, that is something that needs attention. Yeah. Shortness of breath, that is new. Some of the more concerning would be unexplained weight loss is another thing to be watched out for. And if you are having weight loss that's not explainable by diet and exercise, you want to check with your physician. Unfortunately, something like unexplained weight loss would be a later sign. Early signs are basically often associated with other conditions such as asthma and allergies, but you want to get that checked out.
So like wheezing, because I think asthma, I think wheezing and like being hoarse.
Yeah, and that's true, hoarseness. The bottom line is if you have a symptom that's going on and you don't know what it's from, rather than Googling it, looking it up on the internet, maybe trying to treat yourself. That's why I emphasize all my patients, how important it is to have a primary care physician or a trusted healthcare provider that you could go talk to about these symptoms and figure out what's causing it.
And do you think that the fact that it mirrors all these other ailments that is why it takes often a lot of time to get a lung cancer diagnosis?
There's a lot of factors involved. Number one of the reasons I'm really excited to be here and the fact that we have November is Lung Cancer Awareness Month.
And I see that you're wearing turquoise and you have the white ribbon, not the pink ribbon, the white ribbon. That is lung cancer awareness.
Yes, that is correct. So the big issue about lung cancer is the lack of awareness by many people about the burden of lung cancer, the risk factors an individual may have for lung cancer. So knowledge is power.
Yes, always.
Knowing that lung cancer is the leading cause of death and that it can be cured if detected early, and ways to know if you're at risk is key. So some of the risk factors for lung cancer are basically some things that are out of our control.
Okay.
The number one cause of lung cancer is in our control largely, which is smoking. Tobacco use is the number one cause of lung cancer. But the second leading cause of lung cancer is environmental exposure to radon.
Oh, radon. Where do you find radon? Where does that happen?
Radon is everywhere to some degree. It is the breakdown of uranium in the soil, and it is prevalent in certain areas more than others.
Interesting.
It's odorless, it's colorless, and you have no idea if you're breathing radon unless you actually check your home for radon. radon concentrations are higher in certain areas of our state, such as where I'm from, the
Great.
northwestern corner of the state.
Wonderful.
But really, throughout the southeast is a high area of radon exposure. The important part is smoking being the number one risk factor. But if you smoke and you have radon in your home, it actually is tenfold risk.
Wow.
The other thing to consider is if your home has radon and you smoke, you're actually putting other members of your family at risk, especially children. So there is an increased lifetime risk of lung cancer in a child exposed to secondhand smoke and exposed to radon.
Well, I mean, I grew up in the 80s in the South.
Yes.
So, yeah, I inhaled a lot of secondhand smoke in my day.
Yes.
So, but I mean, like, I don't smoke it as an adult, so I'm assuming that's going to help me out.
Absolutely.
Okay.
So one of the complicated factors about talking about lung cancer screening is at present time, we have guidelines for screening for lung cancer. But right now, our main focus is on the highest risk individuals, which are individuals who have smoked during their lifetime. So over a decade ago, we had clear-cut guidelines of the individuals that are high risk, the screening that's recommended, and unfortunately, the uptake of that screening is very, very low. So while radon exposure is a risk factor, your genetics are a risk factor, and your behaviors are a risk factor, the most controllable risk factor is smoking.
Okay.
So I want to make sure those people who do smoke, not secondhand smoke, but those people who have smoked in their lifetime or do smoke, understand what their risk may be and if they need to get screened.
And so basically by doing that, you would just go to your doctor and say, I used to smoke in college, not all the time, but sometimes I might be talking about myself,
Yes,
like if I was at a party, I'd be known
yes.
to have a cigarette.
Yes.
So I should tell my doctor this.
Well, that's important, absolutely. But we have clear-cut guidelines, and it's very simple. The number is something called 20 pack years, and I may want to talk with you about pack years.
Yeah, what is a pack year?
So obviously,
I mean, we had one last year with NC State. It was quite the pack year.
It was a great pack year, and this is a whole different pack year.
Okay,
and we hope we have another great.
Oh, heck yeah,
wolf pack year.
Anyway, sorry. Back to our topic.
But our topic, tobacco. So with many things, it's the dose of your exposure. For instance, radon. I mentioned radon exposure.
Sure.
If you have a high radon exposure, which is over a measure of 4 picocuries, then you should have your home mitigated, the radon exposure lowered. So if you want to know more about that, there's certainly websites available.
Okay.
So one can figure out how to test their home, who to go to test their home to lower that risk. However, we don't include radon exposure in our risk factor calculation because it is a risk factor, but we have to really focus on the highest risk individuals.
Yeah, it's also very difficult to measure. Like if you can't go to every single patient's house and measure their radon.
Yeah, they have to do that.
Yeah, that takes.
But also we have to talk about work, schools,
where
institutions.
You work. Yeah.
So there are policies pushing forward trying to get schools tested. So
I hope so.
That would be important.
Yeah,
we don't want to have that, but. The individual factor, the most important risk factor, is a 20-pack year smoking history. And I know a lot of your interest is on women's health.
Yes, of course.
And, of course, me, as a woman and a female physician taking care of many women, I will point out the reason we have the guideline, which I'll explain, called 20 pack years, is that women and actually Black individuals are at higher risk of lung cancer at a lower exposure, meaning our previous guidelines over a decade ago said that you needed to have 30 pack years. 30 pack years. And that's basically smoking a pack of cigarettes per day for 30 years.
Oof.
Or 2 packs of cigarettes a day for 15.
Gotcha.
It's simple math.
Gotcha.
But if you've exposed your lungs to the carcinogens in tobacco, in cigarette smoke, if you had exposed your lungs to those cancer-causing chemicals to that degree, you were at much greater risk. Well, studies were done looking at different populations, and it turned out that in women and Blacks, it was much lower risk. We were missing those individuals. So now the risk factor is 20. If you have smoked a pack of cigarettes a day for 20 years, say you started in college, but then you stopped when you were 40,
20 years.
20 years.
I know. 20 years creeps up on you.
It does. So it did. It has for me. I don't know about you, but it has for me.
Oh, my gosh. Yeah.
So now there are different guidelines. And that's where the importance of going to your doctor and discussing it, and also my importance as a physician who's an advocate for cancer screenings, can point out. The U.S. Preventive Services Task Force says that if you have stopped smoking more than 15 years ago, that you don't need screening.
Oh, and you don't believe that?
Well, no.
Yeah,
I don't believe that. The American Cancer Society came out with new guidelines last year in November 1st, and it said, based upon clear observational studies and information that we can see in the past, even though it is good to quit smoking, and even though your risk goes down over time, it doesn't go away.
Yeah.
And individuals, even after 15 years, as they age, still have elevated risk. So I really, now, importantly, your insurance companies and the payers, they are pretty much bound to follow USPSTF guidelines.
Who is that?
That's the U.S. Preventive Services Task Force.
Gotcha.
And they make they made the guideline of if you've quit smoking 15 years, your risk has gone down and you don't need screening. What is probably going to happen, I think, in the next few years will be this agreement. I'm hopeful there'll be an agreement.
Okay.
And an individual can be an advocate. You know, you can say to your doctor, well, I understand that my insurance may not cover this because I quit smoking 20 years ago, but if you think I'm at risk, how much does that cost me?
Yeah.
And how do I get screened?
Yeah.
Like you may want to know.
Well, we're going to get to that
Yeah.
for sure. But it's made me think of the adage that I learned a long time ago that you will pay for what you did in your 20s when you're in your 50s.
Yes.
Which
My family doctor, when I was growing up, I joined him in practice when I went back home. And he used to say to his patients, those first 40 years are pretty easy, but those last 40 years take work. So we do. And I love that part of.
I love that adage.
I love that. I actually take care of a lot of patients over 40.
Yeah.
A lot of people in their 20s and 30s as well. But I find that individuals in their 40s and 50s start really seeing wanting to be active and be healthy and be well in their 70s.
Yeah,
so they can travel after they retire.
Exactly.
And you really start becoming more aware. Interestingly enough, this is one of the really important reasons we need to advocate for limiting tobacco exposure to our youth.
Yes.
And limiting, vaping with our youth.
That was my next question.
Yes.
So you're mentioning the chemicals in tobacco smoke.
Yes.
Does that include vaping? Because I've heard of this thing called popcorn lung.
Yes.
So
yes,
I know
yes,
that's kind of two
yes.
questions in one.
That is two in one. So one thing I'll point out to like any healthcare professionals listening or patients that are interested, some people smoke cigars, they smoke cigarillos, they don't smoke cigarettes.
They smoke marijuana.
Well, that's true. We don't have guidance on lung cancer. We're not aware that marijuana smoking increases lung cancer.
Okay,
so that's one thing.
Well, take that, put that in your pipe and smoke it.
Don't do that.
Wait,
don't do that. No. There's a lot of things to talk about there. But there are ways of looking at someone's cigarette use and their cigar use and figuring that exposure. Now, when you talk about vaping, we don't know the long-term implications of vaping. And the other thing that's really concerning, I've had some patients of mine that are trying to quit smoking, and very wisely they say, I have friends who transitioned to vaping.
I've had people tell me that their doctors have told them early in the days of vaping. It was early on, but they said vaping is safer, and they just took that and ran with it.
Well, there are an incredible number of toxins and carcinogens in a cigarette. Like the first time in training that I saw the graph of the number of carcinogens in a cigarette, and I'm remembering my tobacco farm I grew up on and my dad raised tobacco.
Right.
And it didn't look so dangerous out in the field.
It's just a sticky, leafy plant.
Yeah, it's not so bad. Well, it's not so bad, but all of the chemicals that go into either, there's pesticides in raising the tobacco, but then in the process and what happens to form that cigarette, there's a lot of carcinogens. So they pack a lot of carcinogens in that little tiny thing. So that's one of the real risks. But as far as vaping, especially whatever materials they're using in that vape pen, we know that some of those materials, especially certain flavors, certain additives, they're not supposed to be in your lungs.
Yeah.
These chemicals were never meant to be in
Well,
your
you
lungs.
taste them.
Yes,
So they're
yes.
meant to be tasted, not inhaled.
Yeah, so inhaling these chemicals, the long-term implications are something we're going to find out about. And the other factor, some of my patients who want to quit smoking say, I don't want to transition to vaping because I've noticed my friends actually vape a lot more than they used to smoke because they can vape in places that don't allow smoking.
That's true.
So you actually get a higher tendency to become addicted to nicotine. If you're vaping like a nicotine product, you're using it more.
Interesting.
And nicotine is very addictive.
Yeah, it is. And, just like, that makes me think of the whole semaglutide Ozempic thing. It's so new. We're waiting on the long term. So everyone who's doing it now, vaping included,
exactly.
you're basically a guinea pig.
Yeah. Well, we do know, from popcorn lung, and you've mentioned,
what is popcorn lung?
Popcorn lung, the lung on an X-ray looks like popcorn is my,
So
remembrance.
there's like holes in it?
It just is scarred and it looks abnormal. Which gets around to imaging. Like we talked about if you go to your physician, you're coughing up blood, we first start often with an X-ray.
Okay.
But unfortunately, chest X-rays, while they might show popcorn lung and they might show pneumonia, they often miss cancer. And I can remember back in the early 2000s when I was back practicing in my hometown, there was a huge study, going on looking at a better way to look for lung cancer.
Okay.
And many institutions in our state were involved in that work. Low-dose CT. Low-dose CT scans are the way we find early lung nodules and things that are going to turn into cancer or maybe cancer.
What is a CT scan?
CT, like the CAT scan. You hear people talking about a CAT scan.
So is that different than an MRI?
Yes.
Okay,
yes.
and an MRI is the tube.
Well, you lay on a table. The MRI is the tube that's very closely, like you're very close. Very loud. So CT stands for basically computed tomography.
Okay.
It's a way of looking at your body, kind of slicing it up into pieces and looking at the pieces as an X-ray.
Gotcha.
So you can have thin slices, you can have thick slices.
Interesting. Okay.
And a low-dose CT means that there's less radiation involved.
That's wonderful.
Right. So basically, the risk of, there's risk from radiation.
Of course.
Of course. And if you went for a CT scan every single year, a regular dose CT, you actually can increase your risk of cancer.
Right.
Because of the radiation exposure. So that's a concern. So the low dose CT is basically equivalent to getting on an airplane in North Carolina and flying to California.
Gotcha.
That amount of radiation exposure.
Okay.
So you can do these low dose CTs annually for many years and not feel like you're providing necessarily an increased risk of cancer.
Gotcha.
We actually have that information. I would talk to my patients about that. If you enroll in this program where we're monitoring you every year, over a certain amount of time, there is some increased risk, but it's very low. And the benefits of finding cancer early, most of my patients.
The benefits outweigh
the risk in most cases.
Exactly.
And there is shared decision making. With everything you do with your primary care physician or healthcare provider, there needs to be shared decision making. Am I at risk for lung cancer? How do we screen for that? And if you find cancer or a precancerous appearing nodule, is the patient healthy enough to undergo biopsy and treatment? And will they go through biopsy and treatment?
It's a lot of factors to factor in.
That's why you need a physician, a primary care physician, to go through this. And our pulmonologists are wonderful, and our CT surgeons here at WakeMed are wonderful, and they all have the skills to also do that. But they generally see patients after the diagnosis. You're not going to a pulmonologist to find out if you're at risk.
Right. You're going to your medical
provider.
Yeah, exactly.
Yeah.
So how often are non-smokers diagnosed, percentage-wise?
Exactly. Well, of course, there's two different kinds of lung cancer. There's small cell lung cancer, which more associated with smoking, and there's non-small cell lung cancer, which often people hear about, like adenocarcinoma. That is the most common type of lung cancer. Non-small cell lung cancer is about 75 to 80% of cancers. It's less aggressive.
Good.
It metastasizes and grows slower, so that's wonderful. If we find it early, it's often curative, and it has a better prognosis.
Okay.
Small cell lung cancer is about 20% of lung cancer. So there's two different kinds. Small cell lung cancer is more aggressive.
Okay.
It's more associated with smoking.
Okay.
But those are the two different types. Okay. And your question was,
My question was, how often is a non-smoker being diagnosed in general?
So generally speaking, 80%, even maybe in some studies up to 90%, but at least 80% of lung cancer is associated with smoking.
Wow, that's a big percentage.
Yeah, that's why that's your number one risk.
Yeah.
20% of cancers, and unfortunately this may be growing, but 20% of cancers are not associated with smoking. Other factors, the main one being radon exposure.
I just think that's so crazy. That's something that we can't even, notice.
Yes.
Like you need to take it when you're house shopping, basically.
Yes.
Get your radon detector.
Number one, in North Carolina, actually, we advocated in the state of North Carolina, and the real estate organization in North Carolina. To be a real estate agent in North Carolina, you must be trained on radon, the importance of radon.
Interesting.
And you have to talk with your home buyers, are supposed to know the amount of radon in the home they're going to buy. You can ask for that information.
Did not know that.
And if it is high, you can ask the owner to put in a mitigation system, which is basically fans that you are installed so that this odorless gas is pushed out from under the foundation. It basically comes up from the ground, water and soil, and it gets into your home through cracks in the foundation.
Oh my God.
So
you've got me wanting to get a detector for my house.
Do you know how much radon is here?
No, girl, I don't know.
You don't know? Well, you need to do that. We actually, you can buy them at your hardware store. You can get them from your health department. You can check for 24 hours. You can check for a month. There's actually a company here in Raleigh that will come out to your house and check for you.
Okay.
And if you're high, they can put you in touch with people. You really want a reputable person to do the mitigation.
Yeah, of course.
Yeah.
Okay, so
there you go. Lung cancer is number one. Radon and genetic factors are also a risk. And then occupational exposure. Oh my goodness, firefighters, individuals who work in construction.
Airline people, it sounds like.
Yeah, asbestos exposure. There are other factors that are important to consider.
Okay. Mm-hmm. And can you do your own mitigation in terms of lung cancer? Like, is diet? How does diet and exercise affect your chances?
Yeah, well, diet and exercise actually are critically important for reducing the incidence of basically all cancers, cardiovascular disease, and dementia. So
it's just good for you.
It's just good for you. So I spend a lot of time talking with patients about diet and exercise and lowering stress, because all of these factors can play in. The number one thing that a person can do, though, is radon mitigation, avoiding tobacco use, stopping smoking if you smoke, as far as lung cancer. Also, knowing your family history.
Yeah.
We don't count family history in the specific calculation. Well, I'm saying the insurance companies don't count
who's going to pay for it? Because, we are in America, and it can destroy you.
Yeah, insurance companies will, pay for your CT if you meet you are over the age of 50. We didn't get to that. It's 20 pack years and between the ages of 50 and 80.
Okay.
Those are the basic requirements for your insurance, Medicare, Medicaid. They will pay for an annual low-dose CT if you're over the age of 50 and under the age of 80.
Okay.
And if you've smoked at least 20 pack years, and currently it still has that 15 years since quit.
Okay.
That's the insurance. But I was going to say, if you want to pay for it yourself, there are many, many imaging facilities here in Wake County
that you can just go in.
Well, your doctor would have to order it.
Okay.
But your doctor can say, well, Sarah, if you think because, these members of your family and your radon and, X, Y, and Z.
You just want some peace of mind.
And your doctor may say, no, Sarah, you have nothing to worry about, like smoking in college, But if they looked at all the factors and you had a decision. But that, again, is just someone that I talk about, we're talking more and more about personalized medicine and precision medicine.
Which I'm very excited about because we are all so very different.
Yeah. So I think it's more of a conversation. But the real important, push for the American Cancer Society and all the organizations I work with and as a healthcare provider is the age 50 to 80, 20 pack years. And I do want to emphasize that it's important for a patient to know their family history, but to also understand their smoking history.
Yeah.
And when they talk to their healthcare professional, that they say, well, I'm only smoking a half a pack a day now. Because if you go into my office and you tell my staff, well, I've been smoking since I was 20 and I smoke a half a pack a day, and say you're 45, or 40, they're going to look at that and they'll go, okay, 20 years, half a pack, 10 pack years. Well,
be honest.
Well, in your 20s to 30s, if you were smoking a pack and a half, you actually met the criteria. This is throughout all of our healthcare systems.
Yeah.
We have trouble as your physicians getting that information.
Well, because there's shame attached to it.
Yes, we shame. So we try to use words now instead of you're a smoker. We try to say person who smoked.
Or a tobacco
person
user?
who smokes. No.
Oh, because I guess it
No.
wouldn't matter if you do like chew and stuff.
Well, that's more oral cancers.
Yeah.
But person who smokes means you smoke, but that doesn't define you. If that makes sense.
Yeah, that makes absolute
So
sense. You're not a smoker. You're a person.
You're
who
a person who
smokes.
smokes, and so it's not your identity.
Yes.
And I do think there's a lot of fear about lung cancer.
Yes.
Because people think it's a death sentence.
And it's not if you have the non-small cell.
Well, it is. Well, the non-small
it's better
cell.
chances.
Non-small cell is less aggressive, but the point is, if you catch either non-small cell or small cell cancer at early stage, and we can talk a little bit about that. Stage 1 cancers are curable with seeing our lung cancer surgeons, seeing our specialists, and you can remove the cancer and you can be cured. We talk a lot about breast cancer screening, colorectal cancer screening, which is a law that I have, we spend so much time working on those.
Very important, yes.
Very important. Our breast cancer screening rates in the country, our colorectal cancer screening rates in the country are like 75 to 80%. Now, they should be 100% for
But
everyone.
still better than probably lung cancer.
So our survival at 5 years for breast cancer and colorectal cancer is up in the 75 to 80%.
Fabulous.
Our screening rates in the country and in North Carolina for lung cancer screening of the at-risk population is around 8 to 14%. And the risk of the likelihood of you still being alive once you had a lung cancer diagnosis currently because of the lack of knowledge and awareness about screening.
Sure, and like catching it early matters.
Catching it early matters is the mortality is basically like 26%.
Oh, wow.
At 5 years. But if you catch it at stage 1, the mortality is maybe like, your survival is probably 70 to 90%.
Okay.
Yeah.
So-
you can get, your early lung cancer diagnosed, get a lung resection and be back on the golf course in a week. And that's straight from one of my colleagues, Dr. Alden Mayer here at Wake Med.
She did that?
She's
Mine's
amazing.
sorry.
She is we have wonderful lung cancer screening team and they really advocate for primary care physicians to talk to their patients to bring up the question. But we all know visits are rushed.
Yes,
there's a lot
that's
to
exactly
cover.
what I was getting ready to say.
There's
I was
a lot
you
to
get in
cover.
there, everybody's talking fast.
Go.
Yeah.
So this is why that annual wellness visit with your healthcare professional.
Where you get a long period of time to
You
just talk about
well,
yourself.
Long
Grr.
in long in the current framework of medicine is 30 minutes, but instead of that 15-minute visit, you get that 30-minute visit. But what many people do with that wellness visit is they bring up 3 or 4 problems that they've been holding on to.
Yes, I'm guilty.
Well, see, that's the problem. Some of my patients will come in and they go, well, for the last 4 months I've had this, and for a year I've had that, and then this rash came up, and can we go through that today?
Okay.
And what I usually say is, well, it's gonna cut into the prevention part of our time together.
Yeah.
So I tell patients, don't hold them all for
Just
your.
ask as you go.
Well, just come in.
Yeah.
Come in and see us if you have a problem, and then devote that 30 minutes or 40 to all of these things.
Okay.
Yeah.
Well, real quickly, why are blacks more susceptible?
So there's a lot of issues to consider. We feel like there's, the inequities for lung cancer are pretty profound. Basically, whereas white men are more likely to have have lung cancer, black men are more likely to die of lung cancer. So some of it is access.
Yeah, of course.
Our access to care, social determinants of health. There are probably genetic factors where less tobacco exposure leads to, more likelihood of developing cancer. But right now, if you look at North Carolina data, you can evaluate what's the likelihood of being diagnosed early. You're more likely, if you're black, to be diagnosed at a later time. It may be because of not having access to care,
Yeah.
maybe not asking the right questions, maybe not realizing that a lower pack year history is a risk factor for you.
Yeah.
So we're working on that. And also in North Carolina, it turns out that our Native American population, they really have a higher incidence of lung cancer. And there's a lot of research going on to try to make sure access is improved.
Yeah.
Awareness
So
campaigns.
socioeconomic things.
Socioeconomic, 20% of a person's health is defined by the time I spend with them in the exam room and the medicines we prescribe. 80% of it is their habits, their genetics, and their environment.
Okay.
So November's a month that's really important because there's a lot of social media campaigns. There's a lot of outreach. People may say, how do I access these services? How do I find a place to get a low-dose CT?
Yeah.
And Wake Med has a wonderful, wonderful lung cancer screening program.
Okay.
They get referrals from all over. I think that, and I work with the Advisory Committee for Cancer Coordination Control for the state, and we do a lot of outreach with federally qualified health centers, health departments, regional areas. So just because
There
you're
are
in rural North Carolina doesn't
are
mean
resources.
you can get resources. It's about knowing who to ask, where to go, and that there is a need.
Okay, and I have one last short question. You mentioned that tobacco use is the number one thing you need to cut out, right? Because of all the stuff put in there. Does that mean that if you smoke quote unquote natural cigarettes, the ones that are like just straight up tobacco in the packs? Because I know someone's going to want me to ask this question.
That's a good
Do
question.
you know the answer that if that's going to lower your risk at all?
Well, I don't know the answer.
Okay, that's good to know.
That's a good question.
That's fine.
I know that in my reading that it's clear that people who roll their own tobacco, and certainly, well, we do know that people who roll tobacco for like religious ceremonies, there is data showing that there is less likelihood of cancer thought to be with those. I don't think that reduced risk is none, but it's certainly less of a risk than your normal cigarettes you go buy over the counter.
Okay,
Yeah,
perfect.
yeah. So I think that the keys I want. After I eat a meal. I always smoke when I'm out at a party. How do we work with those triggers to decrease that? I have a patient who only smokes in his car, but he smokes really fast in his car. I'm like, you can smoke 3 cigarettes in your car as you drove over here. But, people will have those triggers.
Yeah.
But most of the time, they also have individuals in their lives who love them. And the American Cancer Society has this wonderful campaign is I love you, get screened. I love you, get screened. And so it's like, I love you, stop smoking.
Yeah.
And people know that they should quit.
Yeah.
But knowledge isn't enough. They need resources. So we have a smoking cessation program at Wake Med that's very helpful.
Okay.
These are trained individuals. Medications help. Most people can't crack that nicotine habit by themselves.
Yeah.
But there are medications like Chantix and nicotine replacement over the counter. But even as a physician, I would want guidance on
of course.
the dose.
Of course.
We actually have ways of calculating if you had a certain amount of cigarette exposure, like you smoke a half a pack, how much nicotine should you replace it with?
Right. There has to be some calculation for that. Yeah. You don't want to just take like 5 pieces of gum and then like keel over from nauseousness.
Yeah, that's exactly right. So, there's a lot to unpack. Lung cancer screening is the most complicated screening I've ever dealt with in my career because there's so many factors to consider. Breast cancer, it's a woman, she's a certain age. Let's screen.
Right. This is all about how many, how long.
It's so complicated.
It is, but it's not impossible.
No.
And the most important thing is to talk to your physician. Well, I appreciate your time today. This has been, I could ask you, I literally have a whole other page of questions I didn't have time to get to.
Gosh.
So that means we have to have you back.
That'd be great.
Radon Pack years? Who knew? I'm off to order some radon testing kits for my house right now. Dr. Vicki Fowler was my guest today, and you can find her at wakemed.org. We'll link to some of the things she mentioned in the show notes, including a link to WakeMed's smoking cessation program. It's virtual, so you don't have to live here in Raleigh to do it. Speaking of links, we'd love it if you shared the link to this episode with a friend. Just hit the share button and pass it along. See you next time.